Hello everyone, my name is Esther from Esther Hills Nutrition. I help people with detoxification and parasite cleanses. Today I want to talk about a client I saw this week. She's been with me 6 weeks and she was telling me that she felt a bit sickly about all these parasites excreting in her stool. So this lady is a looker. So some people are lookers, some people are not. It's all okay, whatever you want to do. I'm a looker myself. I want to see what's going on. And she reported longworms, a little thread of redworms, and some rice-looking organisms. With rice, I'm thinking like probably parasite eggs. The thread of redworms, then I'm thinking about hookworms. So if I can share my screen with you. This is what hookworms look like. They are normally sort of whitish or transparent, like in this first picture. You can see they have quite some nasty teeth here. With these teeth, they suck themselves into the walls of the small intestine, and that's where they suck the blood out of you and sometimes protein to feed themselves. When they're filled with blood, they are looking red like this. What happens a lot in these people with hookworms, they have iron deficiency or anemia because they're losing the blood to these worms. They are approximately 1 centimeter long, not very big. They can lay 10,000 eggs, so it's important to kill them quicker than they can reproduce. They can live to 10 years quite happily. The next screen. This is a historical review where we can see, have we always had hookworms? Is that something new? Well, it doesn't look like it is. I think we've always had them. 1838, the first observation of hookworms in post-mortem examinations. That was a long time ago. 1854, post-mortem of Egyptian soldiers who suffered from Egyptian chlorosis, Iron Deficiency Aneamia linked to hookworm disease. 1886, laboratory accident demonstrated hookworm cause infection by penetrating the skin. 1901, first experimental human hookworm infection confirming dermal penetration. This was a study that they actually were confirming they enter via the skin. Dermal means skin. What you can do is take your shoes off when you go inside your home. Sometimes it can come from pets as well, or from, dirt contaminated with feces, like compost. Be careful with that. People report being very tired. They have pale skin, abdominal discomfort as these worms are biting in your small intestine. And you can feel it. That hurts. Nausea, diarrhea, an itchy rash where the larvae penetrated the skin. The next picture. This is the life cycle of a hookworm. The eggs are passed out in the stool. They hatch in the soil where the larvae develop. Larvae are penetrating the skin. Here in the food, they travel through the bloodstream to the lungs. And the lungs, you cough them up. Once you cough them up, some will stick into your mouth and you will swallow them. And that's how they quite happily get to their home in the small intestine. In the small intestine is where they mature. The last thing I want to show you this is one of my favorite writers. This is a book by Hilda Clark. The book is a bit old. It's about 30 years old. So this is another case study which I really like. To learn from case studies. So this is a lady, 36. She had muscle twitches all over her body. She was diagnosed with fibromyalgia. Her joints were tender and her chest felt tight. She had bronchitis twice a year. She was on medication for muscle twisting and on medication to calm the intestine, the spastic colon. She had depression with it and also with medication. It all started with fever and chills that she thought were the flu, but after they went away, she was left with a tremor. Sometimes she felt that little electric shocks were going through her. It's all these weird symptoms, which I see regularly. She had ascaris and hookworm larvae widespread in her body. She also had liver flukes in her liver. So she was started on a parasite program. She first got over 100 liver stones, which came out of her. This instantly reduced her fibromyalgia to occasional attacks. Then she went on full parasite cleansing and most of her symptoms just disappeared. Interesting. The Hannah Clark, a very, very literate, she very well studied parasites all her life. So she's saying most regular anemias, including low iron levels, are associated with hookworm infestation. So most regular anemia. So I'm thinking all these ladies who come to me with iron deficiency, which is so common, I used to have it. You know, hookworm is a big part of that. Okie doke. So if you're sick and you need some help, please reach out. You can have a go to my website where you can book an appointment, or you can book a free consult with me. And I hope this was interesting and enjoy the rest of your day. Bye bye.